So I'm going to start off with a screen share, and as always, I have a PowerPoint. I think I cannot function without a PowerPoint at all. So here we are. So Michal, are you able to see my screen?
I am able to see your screen.
Okay, and I'm going to just turn off my video so that it doesn't show up there. So PCOS and weight loss, why is it difficult? So PCOS, as all of you know, is polycystic ovarian syndrome. It is also called polycystic ovaries. So the different terms, but essentially PCOS is what describes the most common hormonal imbalance seen in women worldwide. And Mikhail, back in, when I was an OBGY, PCOS was like a very common diagnosis, but now the incidence of PCOS has gone up dramatically. So before we go ahead, some of our audience may not be familiar with you and me. So Mikhail, will you please introduce yourself? I'll stop sharing the screen so that they can actually see you. Mikhail, where are you? Sorry.
I need you to start my video for me, Dr. Carr.
Oh, I'm so sorry. I am sorry about that. I think I'll have to make you into sorry everybody, I'm just trying to, I think I'm going to make you co-host, then hopefully you'll be able to. Can you turn on your video now? Yes, I can see you. So Mikhail, please will you introduce yourself?
Fantastic. Well, it's so great to be here with everybody and welcome. My name is Michal Offa. I am a nutrition consultant here in Calgary, Alberta. I work along with Dr. Carr and some other functional doctors to help people balance their health or restore some balance to their health through the foods that they eat. And Dr. Carr and I are both very involved in low carbohydrate eating and fasting. I've studied this extensively, as has Dr. Carr. I've been doing this for about a decade now, so long before it was trendy. And I just really enjoy helping women because we're struggling so much, and especially with the topic that we're speaking about today with PCOS, it is so rampant, and Western medicine really, really struggles to provide solutions, to provide long-term active solutions for this problem, as opposed to symptom management. And that's what I do through food, whereas Dr. Carr does a lot of that with her medical experience. We really work on balancing the gut and through food. And people often say, oh, you're a nutritionist, I need to lose some weight. And I always believe that restoring balance to the body results in effortless weight loss. So that's a little bit of a long story about me. Dr. Carr, how about you?
I'm good. Thank you, Mikhail. So for those of you who don't know who I am, Mikhail and I are actually the co-founders of the Metabolic Dietary Solutions Program. And we launched our program a few years ago, and we are so excited to see the wonderful results many of you are getting through the program. So by background, I was an OBGY for many years in India. So I was delivering babies, doing surgeries, all those things. And about 7 years ago, I moved completely into functional and metabolic medicine. So my areas of focus are women, hormones, PCOS, metabolism, autoimmune conditions. So I'm kind of like a super generalist. And a few years ago, I moved to Canada. So MDS Program is our company from Canada. And I have a medical practice, which is in India. So I run through teleconsulting. And I also work with a functional medicine doctor in Calgary. So that's, I think, enough about us. So I'm going to I'll go back to sharing my screen again. And here we go. So PCOS, Mikhail, like I was talking about before, PCOS is so common in India. In fact, I was talking to a PhD nutritionist a few days ago, and she told me that the incidence in India has gone up so much that she was quoting a figure of like 36 to 40%. So can you imagine, amongst 100 women, 40 women, and these are young women we're talking about, have PCOS. So of course, the question comes up, why has it become so common? Now, on today's webinar, Michal and I won't have the time to discuss all the numerous reasons. However, interestingly, PCOS shows up in, different ethnicities in different ways. And that was something, when I came to move to Canada, I realized, oh my, PCOS shows up here so differently compared to what we were used to seeing in India. And some of the challenges with both of those situations is because of the way it shows up. So in medical terms, I know there are a lot of doctors in the audience today. In medical terms, it's called the phenotype. So the physical characteristics of women with PCOS. And weight loss is one of the big problems for women in India versus, for women of a European ancestry, they are described as what is called lean PCOS. So there lies the problem sometimes because of being lean on the outside. Many women are not given the support that they would like. So some women from countries like US and Canada have had to go through a process for about 2 or 3 years to come to a diagnosis. Now, obviously that has caused a lot of frustration. Whereas in countries like India, the other thing is the difference in the healthcare system. So in India, if someone has any menstrual irregularities, that is one of the commonest reasons people would seek out medical advice. They would go directly to a specialist gynecologist versus, in Alberta, I know the first doctor they meet is a primary care doctor. So it's the family doctor. So sometimes what has happened is family doctors have not always been able to diagnose PCOS easily in lean women. So they've been told, oh, you probably don't have any big problem because it's like, you're not overweight, you're not this, you're not that. But whereas inside, all the problems are already, going on and they've started. Versus in countries like India, some of the commonest problems, of course, women seek out medical advice is because of irregular cycles and weight. And the other area is infertility, inability to have, to get pregnant. However, today's feature is, webinar is on why is it difficult to lose weight, sorry, not gain weight. Now, this is an image from this is there on our website, but the original research has been done by, so you can Google for this Forsyth's obesity map. Now, the reason I am showing this picture is not to overwhelm all of you, but just to show you how complex a problem this is. So PCOS, weight gain, these are extremely complex hormonal and nervous system problems. So as you can see from this picture, there are numerous factors. And if you just saw the image I use when I'm talking to doctors, that is even more complex. My point in showing this is, if you have been thinking that you have a challenge with weight loss because of personal responsibility, I would like to stress upon that it is not because of some fault in you. You are not like personally responsible for all the numerous problems that are happening. It is extremely complex, and it is a very complex interaction between genes and environment. And some of the influences in PCOS and weight gain in general start way before you were born. So some of the influences start even during your mother's pregnancy. Now, obviously, you can't blame your mother for that because there are a lot of things that people don't know. Even me as an OBGY, there was so much I didn't know about before, about the metabolic influences that happen in the uterus when the baby is still not even born, and those can have an impact on your long-term health. So my point is, this is extremely complex, and if you are thinking that it's all because you are not, eating less and moving more, that is the only solution to this problem, then I'm really sorry about that it is way more complex. And if all you have is a tool called, will force, then I'm very sorry. That's a very blunt tool to deal with something as complex as this. And even if you ask your doctors, you'll know that we still don't understand a lot of things about PCOS, but at the same time, one of the things that is absolutely known is that weight loss will impact every area of your metabolism. And when it comes to, women who are called lean PCOS, uh, the metabolic mayhem is already going on inside, and there are ways to find out about that. So the point is, yes, it may take a little longer time for you to be diagnosed if you are lean versus if you are overweight, but the problems are already there. So it's not, and again, sometimes it's a difficulty of finding out what the reason is. But my point is, again, I'm stressing on that it is extremely complex. So don't, if you are someone who's struggling with weight loss, or you have lost weight in the past and a lot of that weight has come back again, or you have infertility, you have difficulty getting pregnant, the fault is not because you are not doing enough. Sometimes it is also the recommendations that you have been given. So, Mikhal, would you like to add anything to that before I move ahead to the next slide?
No, I think keeping it really simple and emphasizing that weight loss is way more complex than calories in, calories out. Eat less, exercise more, and when you have hormones that are involved, it can be a problem.
Absolutely. So, thank you. So again, I don't want to make it very complex, but as all of you have probably found out by now, if you're a doctor, and if you are someone who's dealing with this challenge, that we still don't know the exact causes of obesity. So there are different models that explain this. So the two major ones are what we call, again, the carbohydrate insulin model, and the second is the energy balance problem. And the third, which nobody in the obesity research world or anyone who's knowledgeable about weight gain acknowledges that anymore. It's called the calorie in, calorie out model. And Mikhal, our favorite nutritionist, Dr. Zoe Harcombe, calls that the psycho model, PSYCHO, CICO. So again, I am sorry if I'm challenging many of your thinking, but then science has advanced a whole lot more than beyond just the calorie in, calorie out model. So what is the calorie in, calorie out model, which I'm sure all of you are familiar with? I call that the revenge of the deprived calorie. And we have some blog posts on our website, mdsprogram.com. Basically, it is saying that 100 calories of vegetables is the same as 100 calories of biscuits or cookies, as they'd be called in Canada. And Mikhal, what would you like to add to that?
Well, we all know, and everybody knows, and this is where the calories in, calories out theory becomes a problem, because everybody knows that vegetables and cookies are not the same. That's obvious, right? Everybody's going, well, duh, we know all of that. However, if you're looking at a true calorie model, it shouldn't matter, which we know it does. So just that in itself discredits the cycle, right?
Yeah, and many of you have gone through the frustrating experience of, going on a low calorie diet. You're reducing your fat intake because fat has more calories than carbohydrates or protein. You've lost some weight. So, Mikhal, I get this a lot. Who says this doesn't work? Of course it works. It works for a short span of time. But on our MDS program, the metric we like to measure is how much of that weight you've been able to keep off 1 year down the line. That is one of the primary metrics we measure. Then there are a whole lot of other metabolic benefits which go way beyond the number on the scale. And we don't have time to describe all that in details, but what I mean by the revenge of the deprived calorie is, so you get onto a 800 calorie diet, 1,000 calorie diet. I don't even know, Mikhal, what they follow now. And what happens? You lost some weight. And then after about 3 months, 6 months, you start, okay, you're feeling better, you lost weight, you decide to exercise more. Now, once you start exercising more, you feel hungry. What happens when you feel hungry? You end up eating more. So that is the revenge of the deprived calorie, because what the other thing that happens in terms of metabolism is your metabolic rate goes down when you eat a low calorie diet. So once your metabolic rate goes down, what ends up happening is the same food goes and causes other problems for you. So that is what I call the revenge of the deprived calorie, to put it in, I have simplified it highly, but that is kind of the basic point is it doesn't work for long term. Yes, it works short term. And some of the things, Mikhail, remember, I think in the last podcast, you were talking about some of these super low calorie diets. Most of them have actually had to use some kind of a shake or an artificial product versus using real food, right, Mikhail?
Yes, and that's because a diet really low in calories often doesn't provide sufficient nutrition.
Yes. So what has happened is they have had, like, there are lots of clinical studies, and most of them have been done for 8 weeks, 12 weeks, or even longer. But Mikhail and I recommend a real food diet, so not a shake or some magic, supplement or a surgery or anything like that. So our program does not involve any of those things. So that our program is like, our goal is to keep it as simple and as doable as possible. And you will know from some of the testimonials we've received from some of the people who've been on our program before, how simple and easy it is to follow. Well, and again, we don't always guarantee results, but one of the things that happens with any program is the easier it is to stick to, the better the results, obviously. So what is PCOS basically? And again, I'm simplifying it a lot. So PCOS is a problem of insulin resistance. Many of you are familiar with insulin resistance. Some of you may not know. My highly simplified explanation of insulin resistance is, so insulin is the hormone that is produced in your pancreas, and insulin, as you know, is involved in maintaining your blood sugar levels. So insulin resistance is a condition where the hormone insulin doesn't function as well in your body as it should. Now, it can be a problem of, so if you check your blood insulin levels, it may be high, it may be very low. So that is the reason I explain it a little bit, because what happens is, if you are measuring your fasting insulin levels at the age of, let us say, 25 or 30, and you don't find that fasting insulin levels are very high, does it mean that it has never happened? No. So it is possible that it has happened when you were much younger. In fact, there are some studies from 20 years ago which showed that in India, Mikhail, believe it or not, a lot of newborn babies had high insulin levels. So obviously the problem did not start at birth, it started way before that. So just a little clarification, because many of you go, read a lot of stuff, and then you go and decide to do your insulin levels, and then you'll come back and tell me, doctor, my insulin levels are normal. So that is the reason I've given this explanation. It is not as simple as it seems. So basically, again, this is the proverbial iceberg. So like how the Titanic was destroyed by the part of the iceberg that was below the water level. So all these problems that you can see on this image, which are above the water level: PCOS, irregular cycles, difficulty losing weight, extra hair growth, excess androgens, which are male hormones, depression, anxiety, infertility. These are all the features of PCOS, along with high blood pressure, diabetes, pregnancy diabetes, heart disease, stroke, uterine cancer. All these are the problems that you see above the water level, whereas the underlying problem is insulin resistance. Now, though this is something that has been known for a long time, Mikhail, believe it or not, and I go through the medical literature. So in the diagnostic criteria, if you most of you may be familiar with it, there is something called the Rotterdam criteria. So you have to have certain features like irregular cycles or excessive hair growth, excess androgen levels, and polycystic ovaries on ultrasound. Any one of those alone will not do. And again, I'm not going to the diagnosis, because that is more for a one-on-one consult. But just one point I want to highlight here is, just seeing polycystic ovaries on ultrasound alone, and particularly in young girls, in the adolescent ones, does not mean that someone has PCOS. My point in talking about this is, in the diagnostic criteria, insulin resistance is not even mentioned, but everywhere you read, you will find that insulin resistance is the underlying problem. So it is because of insulin resistance that androgen levels go up, that the ovary starts doing all these other things. So in our world, again, I'm quoting Megan Ramos, who's one of the well-known world researchers who works with Dr. Jason Fung in the world of intermittent fasting, time-restricted eating. She describes PCOS as diabetes of the ovaries. And Mikhail, you and I have talked about, heart disease being diabetes of the blood vessels, and dementia is also described as type 3 diabetes. So metabolically, these things, the underlying problem is insulin resistance. However, the point I want to highlight here is insulin resistance is the underlying problem, but in most of the treatment of PCOS, insulin resistance is not completely addressed. So in I think a few sentences, if you are having a challenge in losing weight, the reason is because your underlying insulin resistance has not been addressed. So that is kind of a conclusion of the whole webinar today, right, Mikhail? So the question comes, how do you know if you have insulin resistance? I'm going to share next slide. So on one side, you can see an infographic. This infographic is there on our website. And I just listed a few of those things on the other side, so that I think you can't read that very clearly. So one is, if you have PCOS, we know you have insulin resistance. Waist to hip ratio. And again, this waist to hip ratio is for South Asians, so people from India, Pakistan, Bangladesh, Sri Lanka. In predominantly European ancestry, the waist to hip ratio is a little higher. Then the waist circumference of more than 31.5 inches. A rough measure would be, half your height should be your waist circumference. If your waist circumference is more than that, then obviously that is belly fat. Then if you've been told that you have a fatty liver because you had an ultrasound examination done, or you need extreme exercise to maintain body composition. That is a sentence, Mikhail, that you had put in, and this infographic, by the way, is created by Mikhail, so thank you so much for creating it. So if you are someone who has to really exercise hard to be able to maintain your, your body weight, your muscle percentage, get rid of your belly fat, that is again an indication that you're probably dealing with insulin resistance and having high triglycerides. There are a lot of other measures as well for which you would need blood tests. Mikhail, would you like to add a few words about that, requiring extreme exercise? Because I know you work with a lot of physical trainers as well. You provide them with the nutritional consultations.
Sure, and there's a lot of women, specifically women out there, and their common complaint is that they're working out way more than the results that they're seeing. So if you find that you have to, run on the treadmill for an hour a day, and you have to work out heavily with weights like 3, 4, 5 times a week, and the minute you stop, your body fat goes up, that we know that there's a problem there. There is no requirement physiologically to move that much. Movement is important, exercise is important, but it should not be a requirement. And there are many other repercussions of over-exercising, which you, Dr. Carr, very, very aware of hormonally. It can really affect your stress, your cellular stress management levels. It can affect your sleep. It will affect how you're eating as well, because the more you exercise, the hungrier you actually get. So yeah, exercise makes you hungry, people. I don't, everybody often forgets that, but there's a lot of women who find that they're working out extremely, and they're not just to maintain body fat. And you would think with the amount that they're working out, they should be really lean and really muscular, and they're not. And to me, that's a problem, because I often make a joke with my clients where I say, we all think the laws of the universe don't apply to us, right? And in this case, they really don't. People are exercising like crazy, and they're not seeing and it's not even the fat loss results. It's the muscle doesn't develop, you don't, like the waist remains thick, those types of things. And one of the first things that we look at is carbohydrate tolerance from a nutritional perspective, or from a medical perspective, insulin resistance.
Thank you, Mikhail. And so just one, because I think we'll run out of time, one comment that Mikhail and I would like to, stress upon is exercise alone, now you have to listen very carefully. I said exercise alone will not make you lose weight. It has to be a combination of diet and exercise. We focus more on movement rather than exercise, but it is also important to understand that insulin resistance also occurs at the level of the liver and the muscles. So if you're not exercising muscles enough, if you're spending a lot of time sitting continuously, and with the ongoing lockdown in India, exercising, going to a gym has become difficult. Whereas in countries like, Canada, what has happened is the type of work we do has changed a lot. So we spend a lot more time sitting than we used to do before. So continuous sitting is something we always stress upon. That is not something that is to be done, because continuous sitting is like the new smoke. So just a brief comment on, if you are relying on only exercise to lose weight and you don't want to bother with the diet or any of the other lifestyle changes, then I am sorry, you are probably heading for frustration. So PCOS, just like I said before, the symptoms are different in women of European ancestry. I talked about lean PCOS before. And hirsutism, the excessive hair growth, is again different in different ethnicities. In some ethnicities, even in Mikhal, believe it or not, India is so diverse. In one part of India, the hirsutism that is present may be quite the norm because of the genetics, versus in some other parts. But the Endocrine Society recommends that if a woman comes to you or me or whoever saying that I'm concerned with the amount of hair that I have, then it needs to be addressed. So that is the thing about hirsutism. There are different scoring systems, and many of you, I have sent you the link to score the hirsutism yourself. So that is important to bear in mind. If it is bothering you, it needs to be addressed. And sometimes the hirsutism can be dealt with through things like laser removal, photocoagulation, all those different things that dermatologists and aesthetic physicians know much more about, while we wait for the medications and the weight loss and everything else to impact it. So my point is, if it is bothering you, it needs to be addressed first, because for many women, Mikhail, hirsutism is not as common in women of European ancestry, but it's commoner in Asian countries. So hirsutism bothers them the most because it is so obvious, and people tell them, "Oh, you're looking like a guy," and sometimes these comments are so insensitive, but people don't realize. Another big thing that I wanted to address here is Hashimoto's or hypothyroidism and polycystic ovaries are very often present at the same time. So there are, obviously, it's not a coincidence, and I'm not going into the details today, but one of the factors could be that, the hormone leptin. Sorry, I don't want to go down those rabbit holes, because Mikhal and I can talk forever about leptin. But the important point here again is leptin and insulin resistance are intimately related. They're almost like twins. So if we don't address the insulin resistance, then all these problems will, continue. The other big one is mental health challenges. So the incidence of, depression, anxiety is about 4 times higher in women with PCOS than women without PCOS. And the solution to that problem is not an antidepressant medication. So Mikhail, you and I have talked about that before. I am not against medications. I am a physician trained in Western medicine. But if a woman has depression along with PCOS and hypothyroidism, taking an antidepressant medication is not going to solve all her problems. Some of the commonalities may be the high inflammation levels, but the other thing is some of the antidepressant medications actually make you gain weight. So, but my point is, if you are on antidepressant medications, please do not stop your medications without consultation with your physician. Whatever Mikhal and I are talking about today is not to be considered as medical advice. This is information only. So mental health challenges is another big area. And the other thing that I've been noticing of late, Mikhal, is incidence of hypertension, high blood pressure in younger women. So back when I was an OBGY, we didn't see as much hypertension in young girls, of course in young men as well, as it is happening now. That is another. And why is that important? Because hypertension And one of the treatments for PCOS is putting women on birth control pills. And those birth control pills contain synthetic estrogen and progestin, not the hormones that your body makes. And those synthetic hormones are associated with a risk in hypertension. So women with high blood pressure should not be on birth control pills. And this is one of the conversations I've had with many of my patients. I said, you have high blood pressure. I'm not comfortable putting you on a birth control pill because that is going to make your hypertension worse. But, and again, Michal, I think the women in Asian countries versus women in Canada, the way they look at their health is also different, because for Asian countries, having a regular cycle, even if it is artificially created by birth control pills, somehow is very important for women. And I don't know why that is, again. Versus, I think in Canada, having a regular cycle is not always considered as a top priority. So somehow and because I was an OBGYN, I remember many women would come and tell me, no, doctor, I think that is the most important thing in a woman's life. And I'm thinking, you're having an artificial cycle. It's not a regular menstrual cycle. But again, different things impact different people. So PCOS is basically a problem of carbohydrate intolerance. And again, we don't have time to go into the details. So Michal, I'll let you take over here. So what should you eat? This has never been a big question before, but in the last few years, I think this is one of the major problems that people deal with every day. So Michal, will you just talk a little bit about how we don't focus on macronutrients and how much protein, how much fat, how much carbohydrates? And then I'll go on to the next slide and talking about what are the essential parts of your diet. So Michal, will you take over this?
Sure. So I just want to preface by saying we actually do focus on what you eat macro-wise, your proteins and your fats and your carbohydrates. Macro means macronutrients. And I'm just going to backtrack just a little bit because we spoke about calories earlier. The body does not measure calories. Your body doesn't know how to measure calories. What your body measures is amino acids, which is proteins, fatty acids, which is fat, glucose, which is carbohydrates, and then some other vitamins, minerals, and nutrients like sodium and potassium and magnesium. So what we focus on is what the body needs, not only to survive, but in order to function optimally. And when you put good gas in your car runs well. And it's the same with your body. When we put good fuel in the body, and we think of fuel as calories, but remember the body thinks of fuel as proteins, fats, carbs, vitamins, minerals, and nutrients. When you put good fuel in, the body is able to run efficiently. It can lubricate what it needs to lubricate. It can find energy where it needs to find energy. It can begin to patch up and heal things where it needs to because it has the tools to do that. If you're just giving the body energy without what it requires, the body looks at this energy and goes, well, that's great, but I don't have the raw materials to put this energy to use. So I believe, and my training has led me to believe, that getting our protein requirements correct is probably one of the most important steps that people can take in restoring their health, because every single cell in the body, every single organ, all of your tissues on a very basic level are made up of amino acids, which come from your protein. So Dr. Carr and I are quite fastidious about always getting protein on your plate. And although, Western medicine has taught us, or nutritional wisdom has taught us, eat your veggies, eat your veggies, eat your veggies, eat your veggies. And I'm not saying vegetables are bad for you, but vegetables are all carbohydrates. They're good carbohydrates, but they do turn to sugar at the end of the day. And without some protein and some fat, your body doesn't know what to do with those. And a lot of people are consuming huge amounts of vegetables and are really struggling. And they don't understand why. And it's often because their protein requirements specifically are not being met. I personally am a huge proponent of animal-based proteins. It's the easiest way to get protein. However, I understand that, especially in India and even here in North America, a lot of people are not eating animal products, and there are ways to work within that to get your protein in. But for me, even if you take one thing away from this webinar, it's every single time you eat. And one thing we teach in our program is it doesn't need to be that often either. And especially if you're getting all your nutrients in, you'll find you're not as hungry, because protein and fat together are very filling. But whenever you eat, look at your plate and say, how am I getting my protein in here? Understanding that animal proteins come with fats. They naturally just come with fats. Plant-based proteins come with carbohydrates. So in our program, we teach how to navigate that world, but looking at your plate, always have some protein. You might want to add a little bit of fat, especially if you're not getting enough. And then, and only then, do you begin to make the food taste good and give yourself some variety with your carbohydrates. And there's ways to choose good and bad ones. Again, we go through that in our program in much more detail. But just so that everybody understands, protein, pure protein, is animal product. Fat is an oily thing, and carbohydrates by default are everything else. So looking at your plate, get your protein in there. And everybody has different protein requirements, and that's a lot more detail than we have time for. But really shifting the focus and getting into the protein. And you'll often hear, oh, we eat too much protein. Oh, we eat too much protein. Honestly, most of us don't. And it's very difficult to eat too much protein. If anybody's ever watched a bodybuilder trying to chug down whey shakes and eat chicken breast and all of those things, they're trying to get more protein in because they need to build muscle. And it's hard and they struggle. So focus on the protein, add a little bit of fat for taste, and then add some carbohydrate for variety.
Okay, we have a question on proteins. I think we'll answer the question at the end. So one more thing that I want to really, highlight here is there are no essential carbohydrates. So what do Michal and I mean by essential components of your diet? Essential means your body cannot make that. So there are no essential carbohydrates. Your body is able to create carbohydrates from other things, but there are about 7 essential amino acids, and amino acids make protein. And there are essential fatty acids like omega-3 fatty acids, which your body is not able to make, but they are absolutely essential to your long-term health. And actually about protein requirements, Michal, you and I can talk until kingdom come. So amongst my patients in India, I find one of the things that you pointed out is many of them are vegetarian, and we'll talk a little, the question is about the vegetarian sources of protein. We'll address that at the end. So vegetarians find it extremely difficult to get enough protein, but believe it or not, people in India don't eat a whole lot of animal proteins either. So they find it difficult to even incorporate, the regular amount of protein that they would need. So protein is something extremely important for your brain, for your bones, for all the tissues in your body to function. And it is not easy to get enough. So before I move ahead to talk about our program, Michal, the question is about, sorry, I'm just reading out the question. Someone has asked about intermittent fasting. Okay, yes, that is a part of our program. So the first question is, what a pure vegetarian may consume for protein intake? Michal, I'll let you answer that.
Okay, so a pure vegetarian, again, we would need to see if they consume dairy and eggs. So if they are purely plant, but like 100% vegan or vegetarian. If they are consuming dairy, then some full fat dairy, if they are able to tolerate it, works well. Small amounts of legumes. I prefer lentils or split peas, dal, because the smaller the legume, the less the carbohydrate, the higher the protein count. We also often, in order to, especially in the beginning, to get that protein up, we often ask a vegan or a vegetarian to supplement with a protein powder, which a good protein powder is usually made from a pea protein or a hemp protein. There's many different types, but if it's been well formulated in a cold environment, and it will say a cold processed on it, it's the protein without the carbohydrate. So it's a way, especially if you're struggling with insulin resistance, to balance out, the ethical or the religious or the lifestyle vegetarianism, and still get some protein in. I'm not always a fan of, supplement, but sometimes it is definitely necessary. So it depends on the person. As I said, there's loads of options. I like the small legumes. I would say minimize those, or stop consuming most other carbohydrates with the exception of leafy greens. So leaves, right? Because everything else will impact your carbohydrate load. No more rice, no more grains, none of those. And and she asked about sprouts. Sprouts are generally okay. Broccoli sprouts are really good for you, those types of things. But focusing on the leafy greens and the legumes, adding in some good fats, so avocado oil, coconut oil, olive oil, those types of things, and or ghee, and really possibly, depending on where you're at, supplementing with a high quality protein powder.
Thank you, Mikhail. So yes, the basic problem is in India, people who are vegetarians, they don't even eat eggs. So it is very difficult. We've had that conversation so many times with participants on our program, right? That without a supplementation, it is extremely difficult, because so a very rough measure of how much protein someone would need is approximately 1 gram per kg body weight of lean weight. So if you are, so Mikhail, just a simple calculation, if someone weighs, let us say, 60 kilograms, so that is about 125 pounds, rough measure, how much protein would they need? I just want to explain how much of a gap that is and how difficult it is. And that's why we teach you a lot of stuff on the program to how to overcome that.
Well, the minimum requirement, is, as you said, 1 gram per kilogram, 1 gram per kilogram. So if you're weighing 60 kilos or around 130 pounds, convert it to kilograms, and it's generally, and that's very, 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 very minimal. I like to go to 0.8 or 1 gram per pound. So depending on where you're at that way. And it also depends on your diet. But if you're weighing 60 kilograms, you need 60 grams of protein. And that's a lot. That's not 60
grams. A lot, exactly. And Mikhail, I struggle with protein intake as well. So just a context, how much of protein is there in one egg? Of course, provided they are eating eggs.
One egg has between 6 and 7 grams of protein.
So I'm just giving the context, and supposing they were to eat because a lot of vegetarian people in India, they think that, the Bengal gram has a lot of protein. But the thing is, it comes with a whole lot of carbohydrates as well, right?
Yes.
So it is a very big struggle to get adequate proteins on a vegetarian or a vegan diet without supplementation. So what does I'm not going to explain our program in details here because our website has a lot. The other question was about intermittent fasting. So our program is based on time-restricted eating, intermittent fasting, low carbohydrate eating, and functional medicine principles, which are, again, essentially we look at your sleep, your movement, your gut-brain immune, your medications, and these are all through group consults, so it's not a one-on-one consult. So time-restricted eating, for those of you who may not know, is eating in restricted intervals of time. So the commonest one we recommend, if you have never done before, is 12-12. So for 12 hours overnight, you don't eat anything. And this is not a dry fast. So we have some fasting fluids. All that information is on our website. For our MDS program, our definition of intermittent fasting is 24 hours or more. So some of you may do fantastically well with just fasting overnight for 14 to 16 hours, but some of you may need much longer intervals of fasting, and this is not a dry fast. The problem with, Mikhail, you and I have discussed this before, and we find this happening so often with people on our program, information is there available everywhere. So nobody will make changes based on information only. And we have a ton of information on our own website available for free. But what most of you need is the support, like the day-to-day problems. And we have weekly webinars where we solve these problems, because both Mikhal and I believe you should not have to pay for information. You need the personalized support. It's things like, today, this is what I did, and this is how I felt. Why do you think that happened? What can I change? Those are the kind of support that we provide on our program. Information is available everywhere. So on intermittent fasting, this is I'm addressing the person who asked that question. You will find a ton of information on our website, but it's basically there is an eating window and there is a fasting window. So those are the two important things. And then of course there is no hard and fast rule that this is the only thing you have to do. There are different ways of doing it. And that is where our program is really, easier to implement, because we don't insist on a meal plan and this is exactly what you have to do. You have to fast for 20 hours a day or anything. No, it depends on where you're at in the journey. And the other thing is, we don't have meal plans. We have food to embrace and food to preferably avoid. And the other major difference between our program and a lot of other programs is we don't call it a diet. It's a whole life plan. It's not like something you just have for a few days and then you forget all about it. No, we help you do things that are going to help you long term. And more importantly, we teach you strategies which you can implement by yourself. You don't have to meet me and Mikhail all the time. So I'm going to share, what do participants of our program say? I'm going to go on to our website. So I'll just, let me just go to the screen share again. And sorry, everybody, I'm just struggling a little bit because I have not. Okay, here I am. Let me start sharing the screen. Okay, here it is. So, Mikhal, can you see the screen, our website?
Yes.
Okay, so this is our website, mdsprogram.com. And I'm just going to share one of the stories of one of our participants. So this is the one I'm sharing because she is someone who has PCOS and Hashimoto's. So enrolling in the MDS program was one of the best decisions I've made for my health. I contacted Dr. Carr at a time when my medical conditions took a heavy toll on me. I have hypothyroidism and PCOS. I had become lethargic, depressed. My weight kept shooting up despite all the measures. And most importantly, I didn't feel like myself. So Dr. Carr's diagnosis gave me the clarity, and the clarity that I didn't know I needed. She walked me through my autoimmune condition and how it had messed up my body. So this was one of the best decisions she made. And the interesting thing is she lost 15 kilograms, and I'm happier, more energetic, more in tune with my body than ever before. However, what I want to highlight again, and again, this is not her actual name because I want to maintain privacy. She has maintained a lot of that weight loss. I think it's been about a year, Mikhail, that she was on our program, right? So
Yes.
that is the metric that we like to measure people by, is how long have you kept the weight off? Because losing weight is like just eat less and move more and you will lose weight. But the thing we want to measure on is, have we helped you in changing your biochemistry so that you're able to maintain the weight loss? Because that is the one that is going to be the deciding factor for everything. Then, of course, we have men as well on our program. So these are just 3 of the participant stories that I have here. And our program is for, it can work across any condition, even other than PCOS. So that is again something, even for men actually. So what is our program based on? I have already talked about that. These are the things. This is on our website, so I'm not going to spend more time on what is already there on the website. You can go ahead to the website and check. So if you have any questions, you can type the questions in the chat box at the bottom. And if you need to reach either me or Mikhail, you can email us at info@mdsprogram.com. And I'm going to stop sharing my screen now. And if you have any questions, please go ahead and type it in the chat box. And Mikhail, somehow your video is gone. I don't see any more questions.
No, I think we covered intermittent fasting, which is great. And yeah, the eating less often, which is what I was speaking about a little bit, is very, very conducive to healing and fat loss, right? Eating more, and I'll get into this a lot on our program, but eating more does not keep your metabolism humming. Eating more keeps your insulin high.
Yeah.
So getting your protein in and eating less often is probably your first step to being incredibly, incredibly effective. And it will allow you to move on to intermittent fasting, from our perspective, or time restricted eating, going without food for longer periods of time, which will further increase your healing and your fat burn. Because when we're eating and digesting food, your body is doing nothing else. It is not burning fat. It is not balancing your hormones. It is not healing anything. It is eating and digesting food. It's very focused. So it's really important. And protein is your key. Protein is your key to that. If you're not getting enough protein, not going to work.
Okay, so we have something really wonderful. Okay, the one question is, do you use only diet and lifestyle to control insulin? Our primary focus is diet and lifestyle, because our program is not based on prescriptions and no surgeries. And most of the time we see such fantastic results. In fact, the person whose testimonial I read, she says, this is, Mikhail, this is what makes you and I wake up in the morning and excited about life. She has lost 20 kgs as of last week. And she was on the program about a year ago, right? I'm so happy for you. So medications depends, because some people come to us when they're already on metformin. So we don't stop the metformin right away. And again, if it's a patient whom I'm seeing as a patient, slowly we have been able to stop that metformin, because metformin doesn't really contribute to the weight loss at all. But with diet and lifestyle alone, we see such fantastic results. And as you heard one of our participants talking about it, most of the time we don't need medications, right, Mikhail? Yeah.
Yes. Yeah, I'm sorry, my dogs are getting a little bit excited with our, because we're offering our program again. Like that. But yeah, diet and lifestyle can really, for the most part, improve things significantly. And medications shouldn't be used as your first line of defense. Medications should always be after diet and lifestyle. So if diet and lifestyle are not working, then we look at medications in whatever that might look like. So it could be a referral, it could be just a discussion, but if you don't address your diet and lifestyle, the medications are never, ever, ever going to long-term solve your issues without giving you, well, they're not going to solve your issues. They're going to mask some symptoms with a whole bunch of side effects.
Okay, so thank you everybody for investing your time with us. And I don't think we have any more questions. And we're finishing on, okay, do you motivate people to even accept requirement of change in lifestyle, especially with lean PCOS and in India? So here is, again, it's not an easy question to answer. And the person asking the question is a physician herself. So motivation will never change anything. So behavior modification is something way more complex than that. And like I said, if a person is looking for some magic cure, we don't have it. I know, Mikhail, you want to add to that. So what we do is, behavior modification is such a serious science, and I won't claim I know enough, but we try to, focus on small progress, not perfection is what we look at. So Mikhail, I know you want to add some things. Yes, we get fantastic results with, lean PCOS and in India as well.
I think education is really, really important. There's so much misinformation and misunderstanding about nutrition. And I always make a joke and I say, you can't unknow something. So, we really start with this education. Why am I asking you to do this? Why do I think that going 12 hours overnight without food is going to be beneficial. And when you understand that, as difficult as the behavior modification can be, there's a different component. There's a different component to all of that, right? So we start there, and we also meeting somebody where they're at. So if somebody is unbelievably resistant, why? And we get into that in some of our Q&As, is really coming up. They might have a spouse, or they might have a family member that's chirping in their ear about low fat is the way to go and eat 6 times a day. And that's all they hear. And they say, I'm going home and that's what I'm dealing with. So I can't change. And we look at how you modify things within their specific lifestyle. So it's not a one size fits all, cookie cutter little program.
Yeah, thank you. So I hope it has answered your question. And the other thing is, we realized that, based on our program attendees, that once they see even a simple weight loss of maybe even 5 kilograms, they are so excited to see those results, because, what the other big thing that happens is they lose the fullness of their face, and they start looking so much better that they're happy to make the next more difficult changes, right?
Yeah, and feeling better too.
Yeah. Okay, I think, yes, we have gone over a time by 3 minutes. That's what my clock tells me. So thank you, everybody. And those of you who couldn't join in live, you will receive the recording, and you will also receive, okay, we have one more question. What to do if person with PCOS suffers from sleeping disorder? Okay, so sleep is, again, I'm unable to answer on, because I have not done a one-on-one consult with you. What do you mean by a sleeping disorder? Is it obstructive sleep apnea? That is something that a neurologist or a sleep medicine specialist will deal with. What kind of sleep disorder you're talking about is important. However, it is also important to keep in mind that obstructive sleep apnea, for those of you who may not know, it is when you stop breathing when you're sleeping. And for women and obstructive sleep apnea, it's a completely different story compared to men. So a lot of women don't snore, but they may still have sleep apnea. So if that is the problem, obviously you need to meet a sleep specialist. It will obviously depend on what kind of sleeping disorder it is. Sleep is another area where we focus on a lot, because there are a lot of you who don't prioritize your sleep. So I hope, I don't think that completely answers your question, but yes, it would depend on what kind of sleeping disorder it is. Okay, this has been great. And yes, I was going to say what else you're going to receive, and other than the recording. So we'll upload this video on our YouTube channel. And if you have any more questions, or you want to book in your initial appointment, please feel free to email us at info@mdsprogram.com. You can check our website for lots of stuff. Another thing is, if you want exclusive PCOS information, I'll also send a link to a form where you can sign up, and you will have to confirm that subscription, because I cannot spam you if you don't confirm the subscription. So that is what, and if you like the stuff that Michal and I are talking about, there is a lot more on our website. We have a YouTube channel, we have a podcast as well. So thank you very much, and bye now. Thanks, Michal, and thank you, everybody.
Thanks so much.
Bye.